Muted.
Or from states around this work has been largely in campaigns designed to ensure parents understand child care choices. So really in that section 2, the consumer education piece, that's going to be something that states, I think, will have a great opportunity to take statewide and include in their consumer education. It's an opportunity to broaden that work, I think, and to make it easily accessible to parents. Other states are working with rating teams on QRIS activities to improve, to first of all include health and nutrition, obesity prevention indicators in their QRIS plans if they're not there. Some states have them as optional and will lead to higher. I've seen some states include it as a baseline. So I think this is now an opportunity for states to go back to their QRIS systems and think about ways to either include them if they're not there or maybe elevate them in terms of their importance in the QRIS systems. And a lot of states have mentioned that they've been doing a lot of advocacy work or interventions site by site that I think could be scaled up in this new plan, in their new state plans. Does anybody have any questions at this point about, if you do have questions at this point, please do type them into the box. But I want to, at this point, turn it over to Julie because Julie can really give us a good sense of the type of interventions that they've been doing with Nemours across the country. And it'll give you a rich picture of the types of things that you could potentially include in your state plan. So Julie?
Hi, Krista, and if you can go to the next slide. So Nemours has been funded by the Centers for Disease Control and Prevention to really work deeply in some states around obesity prevention. And just like Krista mentioned, we see some huge opportunities with the new block grant requirements to further embed healthy eating, physical activity, and breastfeeding best practices into state early childhood systems. And wanted to just highlight some work that we've been doing. Nemours is currently working in 9 states, Arizona, California, Florida, Indiana, Kansas, Kentucky, Missouri, New Jersey, and Virginia. And we're going to be adding 2 more states shortly, Alabama and Washington. We partner in those states with organizations that are working directly with child care providers, Head Start providers, pre-K providers. So in some states we partner with child care resource and referral agencies, in some states it's health departments, and in some states we're partnering with early childhood advisory councils or foundations or coalitions. To date, the project has served over 1,500 programs, and again, of all different types, and we've served about 146,000 children. And we're working on 2 levels. We're really working within these states and with our partners to help providers make practice changes related to healthy eating, physical activity, screen time, and breastfeeding. But we're also working on the systems level to embed that type of training and support for providers in early childhood systems statewide. So in things like their quality rating system, their professional development, career lattice, core competencies, into their licensing standards, into their CACFP program at the state level. And so I want to make sure folks understand that in these states that we're working in, we've both done the macro and the micro, which is to work directly with providers, but then to work on the state level to figure out how to make sure that even providers that don't have direct access to our intervention will have supports available to them to meet best practices. We do know what best practices are in these areas. They've been defined in the Caring for Our Children standards, which I know everybody's familiar with, and so it's a pretty it's not difficult to help providers know what the standards are. I think it's more challenging to help folks actually implement standards in their classrooms and family homes. So we work with them on things like family style dining, on things like water on the playground, changing their menus, and really we let providers kind of do their own assessment of where they are in meeting best practices and then develop a plan for how they want to make improvements. And our model is a learning collaborative model. When we're working at the provider level, we bring groups of providers together. They work together over 10 months. They attend learning sessions and get technical assistance. Our model's been very effective. We've shown that providers can make change in best practices achieved. We use NJACCRRA and Let's Move Childcare. And take a look at the last bullet. Everything that Nemours has done with CDC related to obesity prevention and early childhood is available online at the Let's Move Childcare website. So all of our curriculum materials are available. We have webinars on different topics, and really would encourage people to use these tools in both in working with providers, but also in thinking about at the state level, how can you help your child care administrator and other folks, decision makers at the state level, really remember the issue of obesity as they're thinking through their next state plan, and particularly in areas around quality expenditures, where are there things that could be done to help providers meet quality improvement areas around healthy eating and physical activity. So go ahead to the next slide. So when I talked about working at the systems level in states, we're really trying to make sure that all providers, family child care homes, kith and kin providers, family friend and neighbor providers, have an opportunity to get help in improving their practices. There are simple things you can do to help children be healthier. Just introducing fruits and vegetables at mealtime greatly increases the chance that children will have a better taste for those fruits and vegetables, and they will learn to enjoy them and not, like many of our children, turn up their nose at the idea of a green vegetable. So just exposing children to healthier food, getting them moving. Research has shown that children are incredibly sedentary when they're in childcare, and getting children moving more during the childcare day, getting their heart rates up, and introducing them to healthier habits like drinking water more frequently. We want to make sure that in states all of providers have access to help meeting those best practices. And this graphic that you see is called the Spectrum of Opportunities. CDC developed this, and it basically, each of the little colored balls says, you know, where in your state system could you embed support for providers on healthy eating and physical activity? So you can see that in some states they're working on technical assistance. So who is it in your state that goes out and visits early childhood programs? It's probably licensing, it's probably your QRAS staff, it may be some accreditation coaches, it's probably CACFP monitors. How can all of those people be better equipped to help programs improve their practices around healthy eating and physical activity? The goal is not to send a whole bunch of new people out to visit centers or to visit family homes, but to better equip those folks that are already working with them with knowledge and strategies and techniques to help providers make those changes. Providers, for example, may not know that children over 2 really do not need whole milk. The recommendations from the medical community say that once children reach 2, most children, unless they have specific medical issues, really should be drinking non-fat or 1% milk. Many providers don't know that, and that is a huge area where easy changes can be made that shouldn't be costly for providers, that could really help with the obesity crisis. So we're working in the 9 states to help them identify which of these colored balls, we call them feathers, because it kind of looks like a peacock to me, which of the feathers states can make some changes in and really improve their support to providers around healthy eating and physical activity. And again, in your state, some of these feathers may be real areas of opportunity. In other states that you may say, you know what, our early learning standards are done, they're set, we don't see any other opportunities there. However, there may be things that you haven't thought about, and so one of the things we do with our states is really go through each feather and say, you know, what's going on in your state in this area, and how could you potentially weave in more healthy eating and physical activity? We were meeting yesterday with Miami, Florida, and they were talking a lot about the family engagement feather. They're trying to think about, in all of their home visiting programs, parents as teachers, HIPPY, healthy families, how could they help embed more support to families and home visitors around best practices around healthy eating and physical activity. So that would really fall under the family engagement feather of you know, when home visitors are working with families even before they put their child in an early childhood program, What are the ways that we could be educating families about infant feeding, about the importance of tummy time? And many home visiting programs already do that. But again, looking at places where we could weave it in. Next slide. So I wanted to tell you some work that states have been doing with the spectrum of opportunities, and these are states, like I said, that we're working with. Just giving you some examples, and again, not all these examples may apply to your state, but as you're working with your state child care administrators about how to spend additional quality dollars over the next 4 to 5 years, these are ideas, and we certainly have more, and Krista's team at Child Care Aware of America is going to be working with 6 states to really explore this further. So both they and Nemours can be resources to you to help your state think about places where you might want to invest more quality dollars in improvements to healthy eating and physical activity. In Kentucky, our partner there, the Kentucky Health Department, they're looking at the possibility of licensing regulations that may be improved around the areas of healthy eating and physical activity. And again, I think in most states the issue of licensing regs is one that's rather touchy, and whether or not your legislature will approve them or not. But I think they've done some thinking about what those regulations could look like and where they'd want to see some improvements if there were opportunities for change. In Missouri, their Child and Adult Care Food Program has developed a recognition system where providers who go above and beyond the basic requirements of CACFP can get rewarded in recognition for doing even better around children's food. And the CACFP folks in the state are providing training and technical assistance to providers on how to improve their menus, how to improve the fruit and vegetable consumption, how to reduce fried foods. And it provides an interesting way for a state that doesn't have quality rating and improvement system to kind of recognize providers that are doing really well in this area and advertise to families that they're really trying hard to have quality meals for children. In our North Florida project, they have decided that extra points in their quality rating system will be awarded to early childhood programs that have gone through an intensive project around healthy eating and physical activity. So if a center signs up to participate in a project where they're going to get some training and technical assistance on healthy eating and physical activity, they actually get extra points towards moving up the ladder in their locally designed quality rating and improvement system. And again, their QRIS doesn't have standards specific to healthy eating and physical activity, but they have said that programs that choose to work on it have definitely demonstrated a commitment to ongoing quality improvement that should be rewarded through the QRIS. In New Jersey, they're just beginning a very innovative process of including the Let's Move Child Care tool into their QRIS. So all programs in New Jersey that apply to be part of the QRIS there will complete the Let's Move Child Care quiz. It's 13 questions, really quick and easy about your program and practices in your program that indicate that you're working on healthy eating and physical activity. So providers will complete this as part of their application to be in QRIS, and then when they're assigned a coach, a technical assistance specialist to come out and work with them on their QRIS, they could also choose to work on areas that they need to improve on related to healthy eating and physical activity. So that's a fabulous way that statewide providers are going to be introduced to the best practices, given a chance to assess their program as to how they're doing in meeting best practices, and get support in achieving best practices from their quality ratings and improvement system. In Virginia, they have done, our partner there is the Virginia Early Childhood Foundation, and they have looked at their infant toddler specialist network across the state. They have infant toddler specialists that are funded through the block grant. They are assigned to different regions of the state, and our partners there have trained them on the best practices around healthy eating and physical activity, so that when they're going out and doing work with programs on infant toddler issues, they can be aware of the best practices for infant feeding, for infant physical activity, and really weave that into their work. I also think they've done some presentations at conferences in the state around topics specific to infants. So these are just examples, again, of work that individual states have done to think about how do we embed best practices around healthy eating and physical activity into all of our work with early childhood programs. Some other ideas are professional development. Most states have requirements for a certain number of clock hours per year of ongoing professional development, and many times those courses don't include anything specific on child nutrition or on infant toddler feeding or on breastfeeding. So states could expand their offerings to make sure that the trainings available statewide include those topics. There's also a lot that can be done in the areas of career lattice and making sure that as you're looking at what do providers need to do to move up in their own professional development and their own degrees and associate degrees and bachelor's degrees and CDA, that the courses that they take as part of those should include topics around healthy eating and physical activity, so that providers know what are the best practices and know what's developmentally appropriate for children at different ages. A lot of providers, for example, don't know the right portion sizes for infants and really what infants should be eating at what ages and how to introduce them to certain foods, and that's something that could be built in to coursework that they're taking at their community college or local universities. I think that's it. Those are my examples, and I think Krista and I both welcome any questions you all have or comments or ideas about things that you've done in your state or things that you can think about that you'd like to do in your state. So I'll hand it back to you, Krista.
Thanks, Julie. And so if you have any questions for me and Julie, please type them in the chat box. We will open it up at the end for questions. But now I'd like to hand it over to Ms. Beverly Lynn to discuss what NJACCRRA has been doing in New Jersey around some various topics. So Beverly, thank you so much for being here today, and just let me know when I can advance your slides for you.
Okay. Hi, Krista. Can you hear me?
Absolutely. You're on.
Okay. All right. Thank you, first of all, for allowing us to talk about what we're doing here in New Jersey. I'm representing the New Jersey Association for Child Care Resource and Referral Agencies. And a lot of our work started around 2010. Individually, many of the R&R agencies did work prior to this through foundations and other small contracts, but the vast part of our work started in 2010. We partnered with Shaping NJ, which was a Department of Health initiative which was funded by the CDC. And this was a pretty large initiative. It focused on healthy communities, healthy schools, healthy work sites and businesses, healthy healthcare, where they focused on baby-friendly hospitals, encouraging hospitals to adopt breastfeeding policies, and then last, of course, healthy child care centers. So that's really how we got started. Once we partnered with Shaping NJ, we initiated an ad hoc advocacy committee, which became part of our R&R recommendations to revise child care regulations. And there were some really important partners that we had to help get this done. First of all, we included AAP, American Academy of Pediatrics of New Jersey. We had our Department of Health representatives, our Office of Licensing representatives, our Department of Agriculture, who oversee the Child Care Food Program, were there, Department of Education, our New Jersey School Age Child Care Coalition, our YMCAs of New Jersey, private child care centers, and our Rutgers Cooperative Extension Program, and other groups. So it was a very a large committee, but it represented all of the individuals and agencies that would be impacted by these new regulations being changed. So part of our goal was, how do we begin to engage all of the community providers in this process? So what we did, we held 25 focus groups across the state. There was at least one in every county. And during those focus groups, we talked about you know, here are some best practices. How would this affect your business? Can you provide water every day? Can you, you know, what do you think about limiting TV time and computer use? What do you think about these kinds of things? All of the best practice that we were seeking for. And after we completed all of the focus groups, we found that most providers would be open to meeting some of the requirements if they were in fact embedded in our licensing policy. So at that point, we developed recommendations based on the most current best practices that focused on a number of things. And we sent that information to our Office of Licensing. Now, I will tell you that this was not a fast or easy process, because if you ever had to try to change licensing requirements, you know that there are always going to be some entities that are not going to be in favor of that. And of course, we did run into some opposition, primarily from the for-profit programs who thought that some of these requirements would require them to pay more money or would be additional cost to their program. So, of course, we presented everything to our licensing department, and after almost a year, I would say, in April 2013, the Office of Licensing adopted several of NJACCRRA recommendations, including the 60 minutes of rigorous physical activity for children who were in care over 4 hours, a ban on beverages that included sugar and artificial sweeteners, limiting the amount of fruit juice from 4 to 6 hours a day in the child care program, limiting foods that are high in solid fats, added sugars, trans fats, sodium, and requiring a variety of both fruits and vegetables and whole grains be served, and some restrictions on TV and DVD and computer usage. I might add that they did agree that children under 2 should not have access to televisions and other electronics. However, there were some vagueness on above 2. So while we didn't get everything that we wanted, we felt that it was at least a first step towards some of the goals and objectives that we had. I might add that the Shaping NJ initiative all focused on preventing childhood obesity and eliminating it where possible. And at that time, in 2010, New Jersey was the #1 state in the country with the highest childhood obesity rates. So we were really working very hard to try to make some significant changes. You can go to the next slide. Okay, thank you. So we partnered with the Department of Health and the Office of Nutrition and Fitness Shaping NJ initiative, and all 21 child care resource and referral agencies participated in the NAPSAT project. Our R&R staff received nutrition and physical activity assessment training. We recruited 99 centers across the state to complete the program, and we reached over 7,700 children. We also had pre- and post-tests during this process, and we were able to have some significant findings, I think, after 9 to 12 months of the intervention. So of the 54 indicators on NAPSAT, they were monitored. The median score significantly increased by 26 indicators, and there was no indicator that decreased during the project, which we really thought was great. Keep in mind that the R&R trainers worked in these centers over a 9 to 12-month period to develop an action plan to improve at least 3 areas of concern identified from the NAPSAT pre-test. Center staff participated in trainings on obesity, nutrition, physical activity, personal health and wellness, and television and computer use. So our staff were in these centers over a 9 to 12-month period. So we did see some great results, I think. And then you look back again at the post-test. what was found was more than 2/3 of the centers increased the number of times during the year they provided nutrition and physical activity training for staff. And a lot of that training happened at the resource and referral agencies. More than 60% of the centers increased the number of times per year that they provide parents with information in nutrition and physical activity. We help them develop that information so they could share with parents. More than half of the participating child care centers made changes to improve the quality and or enforcement of their written policies on physical activity and nutrition. And some of our training helped them actually develop policies where there weren't any. So a lot of the work that we did helped to inform many of the outcomes. And then 10 months after the project ended, more than 3/4 of the responding centers reported that changes made in their centers during the project were still in effect. And we know that that's pretty significant. You can go to the next slide. Thank you. We also have now Let's Move Child Care. Originally, we were working with Color Me Healthy and other curricula, but there was a decision made that we would use Let's Move Child Care. And in doing so, we actually had another initiative with the Department of Health just a year or so ago, where all 21 CCR and Rs were trained in Let's Move Child Care. We recruited 150 centers statewide to participate in Grow NJ Kids, and the Let's Move Child Care program is also embedded in Grow NJ Kids, and I think Julie mentioned that earlier. But our child care resource and referral quality improvement specialists are the individuals that actually recruit centers into our QIS, which is Grow NJ Kids. They do the initial orientation with them, and up until this point, we haven't transitioned quite yet. We are still doing all the technical assistance and support and training for those Grow NJ Kids centers. So our QIS have actually met with centers. They've trained the centers on the Let's Move Child Care checklist. It's embedded in our Grow NJ Kids assessment tool, which Julie spoke about a little earlier, and we are actually making sure that a lot of the best practices are occurring. Now, we will be transitioning our programs that are in the first year, not our pilots, but our first and second year programs, into another entity, which is going to be called a technical assistant program. And so at that point, they will continue the work they've already begun with the resource and referral agencies and our quality improvement specialists, making sure that they are meeting all the Let's Move Child Care Checklist requirements. So in addition to that, and we've done a lot of work, and some of the work that we've done recently was just to work with the Department of Health and also providing training. And we just recently, I'd say in the last 3 or 4 months, did a 2-hour training that was developed by New Jersey Department of Health on nutrition and physical activity for child care centers in our county. And it was open to all child care centers. It was not restricted to Grow NJ Kids. And we are now in the process of doing the post-test evaluations of those programs. So I think that's pretty much for what we're doing here in New Jersey. Our work certainly continues. I'm happy to say that we're no longer #1 across the nation in childhood obesity. I'm not quite sure where we are, but the last I looked at, we were like 2 or 3. But I think that's still significant improvement, and you know, we'll continue to move forward. So thank you for, and I guess if there are any questions, I'd be happy to answer them.
Fantastic. Thank you so much, Beverly, and for all of you who joined today, especially our presenters, our guest presenters on the phone, Julie Shuell from Nemours, for talking about the fantastic work that Nemours has been doing in several states with interventions, with programs and providers, and also to create systems change. They're truly a leader in this field. And then also for Beverly from the Child Resource and Referral Agency in New Jersey at NJACCRRA, for sharing the incredible work to move the needle in the health arena for children and child care. It's really some great information for several on this call. So again, thank you. I'd ask you both to stick around a little bit in case there's some questions specific to your project. And with that, we also heard a couple of people got an email reminder from the web services platform for the call being a little bit earlier. So we apologize that we're checking in on the problem, and we'll ensure that that doesn't happen in the future. So thanks for your feedback for those who received the earlier invite for this. Again, this is part of our Child Care and Development Block Grant Implementation Station webinar series. So we thank you for joining. And for those who have questions, please type them in the chat box. I'll do my best to read them out loud and address the specific presenter who the question pertains to. And also, if you have any resources, ideas, or thoughts to share with the entire audience, please use this time to do so as well. Thank you. Okay, well, this first question is to you, Beverly. It is asking how many NJACCRRA submits to licensing, and what was the specific screen time licensing requirement that you all determined. So if you have that information, you're still unmuted. Go ahead and answer.
I'm sorry, I didn't hear the question completely. Krista, can you repeat it?
Sure. So the first question actually, I think, is well, let me start with the second question is, what was the specific screen time licensing requirement in New Jersey? Do you have that information?
Well, prior to our conversation, there were no screen time requirements at all in licensing. Now, I think for preschool children, and I'll have to probably provide you with the information as a follow-up. I believe we're somewhere, it's very vague. It doesn't say specifically how many minutes. We were initially asking for not more than 20 minutes, but I don't have that information at my fingertips.
Okay, and then I'm missing one word in this question. And it got an update. In what year did New Jersey have the highest obesity rate was another question. If you have that information, and if not, we can definitely get back to this.
That was in 2009, 2010.
Okay. And one more question for you, Beverly. How many regulations did NJACCRRA submit to licensing, if you can remember?
Wow. I would say probably, I'm sure there was at least 20, or if not more. And what I didn't mention earlier is that when licensing began to look at making changes in the regulations, they pulled together a committee that it represents all of the child care programs in New Jersey. So there was someone representing for-profit, someone representing Head Start, someone representing non-profit, and so although you have all of those members around the table, all those individuals around the table, typically licensing goes with the least resistant scenario. So if, let's say, there's a large group of for-profit saying we really can't afford this, we really can't, they will begin to put little things in licensing. It won't say you have to do it, but it say maybe it's recommended, or they may do it, or they use language to that effect.
Fantastic. So it looks like there, for right now, are no more questions, but I did want to encourage everyone on the call to look at the resources and contact information on the screen to find the different email addresses and names of the various presenters today. Also, the slides and this webinar will be posted on the Child Care Aware of America website at usa.childcareaware.org/connect-with-us. On our website. So we are incredibly happy to have, we had a great crowd today. We look forward to working with you all on this topic, and we hope you have a wonderful rest of your day. Thanks again to our presenters, and take care.
Bye-bye.